can we find an MPDSR lookalike platform for surgery? So that the data is talking about, the figures is talking about, we can pilot that, because now MPDSR has now become part and parcel of counties, where governors are sitting to listen to maternal healthcare and neonatal issues, but you don't have a platform. We need you to be plugged into that platform, so that these numbers, these dashboards, can be consumed. When you look at Tibabu, and all the platforms that are piloted, you don't see matters surgical health. Hakuna. We're discussing maternal, neonatal, etc., etc. So I plead with all of you that we find a footing into the council. Makueni will be first if we are going to drive the agenda. Your number one supporter and ambassador at the Council of Governors will be me. So let's start there. What all of you need to do, and particularly where you sit as president, is to now engage county leadership, so that then you cushion your members, so that your members are not problem about us. And I say, speaking on behalf of leadership, is that we have created a bureaucracy that is supposed to help, but it doesn't help. When I was dealing with Dr. Mudhoka, I changed the pyramid from bottom up to top bottom. So it starts at the top going the other way around, because it's easier and faster. Now, the society must then understand the budget cycles, so that you don't leave it to the finance team to do budgeting, planning. Because I was told the surgeons don't attend the meetings. When it comes to budget, they don't attend the meetings. So nobody sits in the meeting where the 1+1 is being done, because you think that's not my work. But the person sitting at the top does also understand what is happening and will skip you when it comes to your equipment, your reagents, etc., etc. You're now in the budget cycle currently. So budget cycles for counties means on 30th of April, the executive must submit the budget. By 30th of June, the county assembly must pass the budget. At the national level, you have a budget policy statement that is tabled in Parliament on 15th of April, must be passed by 15th of February, must be passed by 20th of February. It has timelines. So don't leave your work to minimal invasive and cutting and reagents. Also get a team in your executive to understand budget cycles. Once you understand the budget cycles, it becomes easier. It's easier for a county to start purchasing cars and purchase ambulances. It's easier for them to buy big cars, not ambulances. It's easier to go and do big projects and not buy equipment, because they really don't understand. So it's important that the issues that you're dealing with are demystified in budgets. Whether it's reagents, if it's surgical care, let it have separate budget lines, separate cabinet papers. What Mudhoka is doing comes separately. What the reagents lab comes separately. HR comes separately, so that we don't talk about budgets globally. Because when you talk about budgets globally, when I say health is taking 38 to 40% of the budget, 50 of which is HR, the rest of the things that Dr. Mudhoka, Dr. Ombati are doing disappear in the woodwork. For political purposes and governance, if you are not on the table, my friends, you are on the menu. So can the Surgical Society Group President find a way to find the Surgical Society on the table of discussions? Put yourself on the table, don't ask. These doors don't, it's only in the Bible where you are told to knock and the door shall be opened. Don't knock, break the door and sit on the table, so that some of the things that you are going through can find footing on the table.
We have a lot of patients flying out to the Near East, to the Far East, to the West, to look for these services. But what we realize is the people who are there is not that because they are trained better than Kenyan surgeons. It's because they have all this gadget, all this technology, all this equipment that my colleagues have spoken about, that then they can deliver the care that these patients desire. When we see those patients who come from the foreign countries for medical tourism and come back to us, we are like, but we've been doing this thing in Kikuyu, why did you go? But the patient is like, but we didn't know. So it is at that moment where then we need to use every media and space available to tell the story and to have the patients understand this is available to us.
So surgery will become a central pillar, not just an afterthought. Everybody focuses on maternal as they should, on primary health care as they should, but surgery is a huge pillar. Most of us will have to face it at one point in our lives. If we have an appendix, a gallbladder, anything that even is simple to the most complex. When you need that surgical care and intervention, you want to know you are well resourced in your counties and in your hospitals. And that is on the surgeons to be able to communicate that to your leadership. Proximie allows you to also track and audit cases. If there is something that happens in a theater that you want to understand how can we do it better, what might have gone wrong, you can go back and audit those cases and make it very clear. And this can then be shared cross-county at a national level to really improve the standard of practice, right? We talked about football players. You can only improve when you watch yourself after the fact. You see how teams are interacting in the room, because the operating theater, you might not know this, it's like a symphony. You've got many people from nurses to anesthesiologists to the surgeon, and they're all moving together like one ballet, okay? So you can watch that and see how are we going to be more efficient. And I think this is important. It's an immutable record that allows you not to be punitive. We need to have a culture of learning and humility so that we can get better. This is where we bring access closer to where people live. That's exactly what everybody wants, right? As a citizen, we want to know that we can get access wherever we are, because every human life is precious, right? So from this, we've spread. We now have 50 ORs throughout all of East Africa. It started in Kenya. Kenya is now the flagship. 38 of those 50 are here in Kenya. Kenyatta National Hospital now is putting 8 theaters in to support all this surgical learning and creating these digital communities of practice, surgical practice, to reach every citizen. And I think we need to remember that more than 50% of the sub-Saharan African population lives more than 2 hours away from surgical care. That is not okay. We can't make more surgeons quicker, but we can help upskill who we have and make it easier for them to be able to do the procedures they need to do. Currently, Proximie's got 38 digital OR hubs in Kenya out of the 50, and thousands of surgical interactions that are being held as a data repository, the patrimony of this country surgically. Think about this. This is cases that you can learn from. Surgeons learn from one another. It's like football. Many of you like football in the audience, and you know that when you're doing football, you are watching after the game tape, right? How did I hit the ball? Did I do it right? Could I have been better? Why don't we ask this from our medical community to do the same? And this is what they're starting to do. We are in 15 counties currently. We have a partnership with the Council of Governors. This is county driven. It's really fantastic to see that. We've got from Makueni to Muranga to Mombasa to Tharaka Nithi to Wajir to Homa Bay, Garissa.
There's a gap in surgical service provision. And the interesting thing is that Kenya as a country is actually ahead of the neighbors. And so right now, we have been focusing on ensuring that each of the county hospitals have a surgeon that is available there to offer care. We are not quite there yet because, as you know, many counties, sometimes people have to move from one place to the other. The specialists and the super specialists. So super specialist is somebody who is doing something very specific, you know, like a surgeon for the children or surgeon for the children for the heart. But one of the core areas that we are focusing as a society is that in each of these counties that you're able to access the basics of surgical care.
We really must take minimally invasive surgery, that is laparoscopy and endoscopy, to be part and parcel of what we do every day. And if it means engaging the governing system, your governments, your administrations in your hospitals, you have to aggressively intervene in that sector, because we cannot stay behind and let minimally invasive surgery not develop in our hospitals.
If you do not attach yourself or become just doggedly determined to get the administration on your side, you will not grow, because they're the ones who will be in the budgeting. They're the ones who will decide whether you will get what you're asking for or not.
The Surgical Society has been thinking about how to have surgical data shared in terms of pathology, gaps that are there, equipment that is needed, and that is what we need to raise and share out. We cannot go and sit on a table without numbers.